While doing any strenuous work, if you are leaking few drops of urine, or if you can't control urge for going to washroom, or if you are experiencing something coming out of your vagina, this is the sign of weak pelvic floor, and this video is for you. Hello, I am physiotherapist Dr. Komal Shah, and today we will learn all about Kegel exercise. Kegel exercise are specially designed exercise to strengthen the weak pelvic floor. First we learn what is pelvic floor. So pelvic floor is between your two hip bones at the bottom of pelvic ring. This pelvic floor helps in supporting your pelvic organ like bladder, vagina, uterus and rectum. Pelvic floor muscles helps in sexual function as well in childbirth and in some activities like pushing any objects, weightlifting, sneezing or coughing or defecation. These muscles contract reflexly to maintain the intra-abdominal pressure. During pregnancy or after childbirth or any surgical trauma causes the weak pelvic floor. Even after certain age, hormonal imbalance or menopause may cause pelvic floor muscle weakness. Because of pelvic floor muscle weakness, you may have poor urine control or prolapse of pelvic organs, and sometimes you or your partner may not enjoy sexual act. So during this time, the Kegel exercise plays an important role to strengthen the pelvic floor. So we will learn here how to do Kegel exercise step by step. For learning Kegel exercise, it is very important to identify which muscle to exercise, because pelvic floor muscles are not visible from outside as your hand muscles or leg muscles. So many times women get confused which muscle to exercise. So pelvic floor muscles are the muscles that surrounds your urethral opening, vaginal opening and rectal opening. As seen in the image, you can take help of the mirror to see, observe and identify your perineal floor muscles. You can feel L palpate with your hands too. For exercising pelvic floor muscles around your urethra, you have to squeeze and tighten the muscles as if you are trying to stop the urine flow. Imagine you are in a washroom, you are passing urine and somebody knock at the door. You are stopping the urine in midway. So these the muscles that are holding your urine flow are the muscles around your urethral opening. For exercising muscle around your vagina, you have to tight the muscles and pull it upwards towards the navel. For tightening or exercising the muscles around anus opening, you have to squeeze the muscles as if you are trying to stop the passage of gas or you are trying to stop the urge passing the motion. Simultaneously squeeze and lift the anus towards the navel. So by practicing this exercise, you will get the strong contraction of the pelvic floor muscles. But while doing exercise, it is very important that there should not be participation of any other muscles like your inner thighs muscles, buttocks or abdominal muscles. You don't need to hold your breath as well. Your focus should be only on contraction and relaxation of pelvic floor muscles only. So after identifying the correct muscle, after learning how to contract the pelvic floor muscles, now we talk about how to improve strength and endurance of pelvic floor muscles. So for improving the strength and endurance of pelvic floor muscles, suppose I am holding the contraction for 5 seconds. Then I will go further for the 6 seconds contraction, holding the 7 seconds contraction and so on 10 seconds holding the contraction. Here the relaxation is also important as contraction. So if you are holding the contraction for 5 seconds, you have to release the contraction and relax the muscles for 5 seconds. Again, if you are contracting the muscles for 6 seconds, you have to relax for 6 seconds again. So this is called the slow Kegel exercise that is helpful in holding the urine for the long time, as in jumping or running activities. But in some activities where your pelvic floor muscles should contract reflexly or promptly, you have to do Kegel exercise. These activities may be coughing, sneezing, or lifting any weight where the pelvic floor muscle should respond quickly and strongly. Once you learn the slow Kegel exercise and fast Kegel exercise, practice this exercise 3 to 4 times a day. It will take hardly 3 to 4 minutes to complete the whole exercise program. But here the most important thing is to do the right technique and contracting the correct muscles. Then and then you will get the perfect results for Kegel exercise. Keep patience, do practice regularly. Once you will get confidence, you will be able to do this exercise in supine position, in sideline position, in sitting position or standing position. You will be able to do this exercise while cooking, in office or while watching the movies. You will be able to do exercise with fully confident. So here we have spent a lot of time identifying the muscle, how to do correct exercise, explaining the exercise. Now it's time for demonstration. So I will show you how to do Kegel exercise step by step. So make yourself relax. Before exercise, empty your bladder. Find out a quiet and private place where you can do exercise. Take a comfortable position. You can do this exercise in lying position, sitting position or standing position. But I will recommend, if you are beginner, you start with supine position. So here I am taking the position. Take a mirror. First of all, identify your perineal floor muscle. So in the mirror, you just observe and identify the muscles. So you can use the mirror for the visual feedback. You can palpate or feel your all perineal fold. You can use any lubricant for inserting the finger for easy sensory feedback. For starting the exercise, exhale slowly and try to squeeze and pull your perineal floor muscles around your vagina, uterus and anus. Squeeze and pull it up like an elevator. Imagine the door of the elevator are closing and the elevator going up, or you can imagine like you are closing the zip of the pant and the zip is going up. So slowly pull it up towards your navel. Hold the contraction for 5 seconds. Slowly release the contraction and relax for 5 seconds. So from here 5 to further strength, I will go for 6 contraction, 7 contraction and so on 10 contraction. Make sure that your muscles should relax as well. So if you are contracting the muscles for 5 seconds, it should relax for 5 seconds too. Make sure that you are not using your inner thighs muscles, buttocks muscles or abdominal muscles while contracting the pelvic floor muscles. Do not hold your breath as well while doing the pelvic floor contraction. So this is the simple practice that you can do for the slow Kegel exercise. For the fast Kegel exercise, you just have to strongly and quickly contract the pelvic floor muscles and relax as well. Strongly and quickly contract the muscles and release. So you can do this practice for 10 repetitions. So once you learn the perfect technique and learn how to do the correct exercise, you will be able to do this exercise in sideline position, standing position or sitting position. Once you are very much confident for doing exercise in different position, then try for the Kegel ball exercise. Same as the gym workout. You start with 1 kg dumbbell, then you progress for the 2 kg dumbbell and then 3 kg. The same way, start with the small Kegel ball and then go and further progress for the heavy one. You can do this exercise with different variations, with hand movements or leg movement. You can do this exercise while bending or while bridging or while your leg movement. After doing the very well exercise, or after you are confident for the good strength and endurance, you can incorporate this exercise with your functional activities. Like before bending, do your Kegel exercise. Contract your pelvic floor before bending. While sneezing or coughing, just try to have consciously contract your pelvic floor muscles. While bridging, just contract your pelvic floor muscles before doing any activities. So this way your pelvic floor muscles will learn and will be trained to contract every time before increasing intra-abdominal pressure. They will try to maintain the intra-abdominal pressure. They will try to prevent urinary leakage. They will try to hold your pelvic organs. Before ending the video, I must say that Kegel exercise will work differently on each person depending on their pelvic floor strength, their ligament support and their hormones. So if you are experiencing that you are not getting result even after 4 to 6 months of the exercise, you must seek advice of doctor. If you are feeling any abdominal pain or inner thighs pain or buttocks, you should stop the exercise and seek the advice of the doctor.